All right, let's talk about COVID. And, along with Brian Sitnick, one of the first things that I talked about when people were talking about COVID lockdowns, just something I was right about very early on, was that the pandemic was going to push a lot of people into poverty. And I'm not talking about, American poverty, which, is serious, but people have things in America when they're impoverished, but we're talking about poverty on a global level. This is people living on less than $2 a day. And an additional 97 million people have been pushed into poverty in 2022 due to the lockdowns. And that is, an increase for the first time in 20 years. Other than that, the number had been plummeting. And so, not only have you reversed the trend and are likely, probably to keep it going in that direction until you allow things to return to a much more reasonable level of normal, but you've also undone all the progress that was being made, progress that will likely never be made up for, which, when we're talking about people being moved into poverty, we're talking about significantly increasing their chances of dying, especially in the young and the old, really reducing the average lifespan, of people when you move them into this level of poverty. Now, there is an extreme level of poverty below this that I would be interested to see if that's also increased, but I haven't found those numbers anywhere yet. Largely this is an issue that hasn't been talked about, though. People are so caught up in the lockdowns and everything like that. Very little attention is paid to what impact this is happening on a global sense in Africa, in the Middle East, in Asia, in all these places where they're, in Latin and South America, where there's people who, for them surviving is a difficult part of life. There's no grocery store, or if there is, they typically don't have money for it. There's not like SNAP programs or things like that that are really making up the calories. Maybe you could get handouts from UN World Food Programs, but a lot of times those are few and far between. In war zones, it's even more difficult. And when you take away all the ability of global resources to get where they need to go, those most marginalized people are, going to be the ones that get squeezed out of having food. And I just worry that number is actually far higher than the number of people who are dying of COVID. And when we're looking at COVID deaths, not that people who are younger can't die, not, somebody my age could get COVID and die, it happens. Children could get COVID and die, it happens. But you're looking at people starving to death. Children starve to death. It's not usually adults. And so, if we're increasing the number of people who are dying because of poverty, it's likely to be biased in the other direction where COVID's the elderly. For poverty, it's the very young. And I'm sure the poor, the elderly too, but particularly the very young. All right. Biden is considering these travel restrictions that I think will probably not be put into place, but I'm not so sure about. He said if medical advisors recommended it, he would put into place a vaccine restriction or mandate for travel on airlines at least, and I'm guessing this is going to include bus service and like Amtrak train service as well. Although maybe it's different if it's like a local state service, like I know like the Chicago state line runs into Wisconsin or something like that. Maybe that wouldn't count, but I'm sure Amtrak services would, right? And so this would be a really serious step up. And I guess the real question I would ask that I'm not seeing being asked is throughout the entire pandemic, both administrations, Fauci, everyone has insisted that air travel is safe. And this was pre-vaccine. Now, if you're wearing a mask, air travel is safe. And so what would be the increased risk to people traveling with being unvaccinated if wearing a mask on a plane when everybody was unvaccinated was safe? Now, I questioned all along if that was true or not, and I'm still very skeptical of that, but I don't know. If that is the case, then how are you deciding this scientifically? And I think just reveals, when you look at it that way, the real purpose of this is to force people to get vaccinated by making their lives more inconvenient, but not really having an actual like health scientific reason behind it. And, we've seen in the past that when Anthony Fauci thinks that something will be for the greater good, he's willing to tell lies to get people to believe it. Let's see. Biden is ordering more of the COVID Pfizer pills. These are the ones that if you take them, I believe you had to take them pretty early on after you get COVID, but they're really supposed to help, according to like the data that's been put out, not get as bad a case of COVID, get over it faster. It's called Paxlovid, and the Biden administration will now be buying 20 million doses versus the 10 million doses they initially planned to buy. Not quite sure why they're preferencing this over the Merrick pill, and exactly how much they're paying for it, and how all that's working, but potential for I think massive corruption here, and also could be if there are more of these anti-COVID pills and they do work enough to that the U.S. government is buying 20 million of them, does that mean it's time to end any lockdowns and restrictions? Because, if there's an effective way to treat COVID and you just make these pills widely available, are any of the other measures really that important? You have the U.S. Postal Service asking for a temporary waiver from Biden's vaccine requirement. This, I guess, would be the OSHA requirement that the USPS is concerned about falling under, and they say that not a lot of their employees have been vaccinated yet, and they're having trouble lining up testing. They're saying that part of this reason, and this actually sounds somewhat understandable, is that they just got through their really busy season. People weren't able to take off work and all that, and so I don't know, maybe that made sense, that they there are people at the post office who will get vaccinated who haven't yet because of that reason, although the vaccines have been around for quite some time, so I'd be kind of surprised that that was actually the case. Maybe the company or the post office feels like they're going to be able to push people more now that they're not so busy with other things. They're not worried about people quitting in the midst of the time where they really need all hands on deck and things like that. An interesting note that I picked up in this article is that while the mandate, the Biden mandate, will take effect on January 10th, that's only technically because OSHA, the agency that's enforcing it, says the agency would not issue citations until February 9th. And so with this now being in court, my guess is that we're going to have the decision from the Supreme Court before this actually is in effect. A couple other important court decisions here. A judge ruled in favor of Navy SEALs seeking religious exemptions from the COVID vaccine. I think there are 35 SEALs that were suing, saying that they should be entitled to getting religious exemptions that essentially were not being offered by the Pentagon at all. I don't think anybody's gotten them, or maybe one or two people have only gotten the religious exemptions now. And the judge said that the Navy cannot disqualify them or deem them permanently non-deployable for refusing to be vaccinated for religious reasons. And it'll be interesting to see how far this case goes and how much is going to impact other members of the military, but it's the first court win I've really seen for anybody in the military. While this is going on, the Navy announced they removed 20 sailors who refused to get the COVID vaccine, although I do believe they were in what would be the equivalent to the private sector probationary period, the first 180 days of duty. I really have some questions. Now, I guess if maybe 180 days ago was just before it was very obvious that the Pentagon was going to put in place this vaccine mandate, but I don't know, it should have been obvious by then that they were going to put this vaccine mandate in place. So I have a little bit less sympathy for you if you're trying to join organizations that have the mandate in place and then you join and they kick you out, which seems to be the case with these 20 sailors. As far as I could tell, the Marines have been the far most aggressive with removing their members for not getting the COVID vaccine. I've been talking about what's happening with the Oklahoma National Guard throughout the the general in charge of it and the governor were pretty united against saying that their guardsmen did not have to get the vaccine. And what the Pentagon did is, as expected, they leveraged what they fund and said that those guardsmen will not be able to participate in the drills that they need to participate in to retain their active duty guardsmen not I guess active duty, but qualified guardsman status, can participate in the guard and everything like that after January 1st. And the Oklahoma Guard lost in court on that. And so that's the situation for them. Georgia is deploying their National Guard and spending $100 million to boost hospital staffing. And, this is one of those things that, look, everybody's talking about the hospital staffing and everything like that. This is a major issue, but it is a self-created crisis here. We required all the hospital staff to have COVID vaccines when a bunch of people, first of all, the mandate for the hospital staff was the first. And so, people are far more skeptical, I think, 4 or 5 months ago than they are now. So that's a part of it. But also a lot of these nurses were people who had already had COVID. And so, now you have a problem that you forced all of them to quit with staffing. And it's just another self-created crisis here, a lot like with the poverty crisis that we're now facing on a global scale. All right, just mention quickly, the U.S. is giving away a bunch of COVID vaccines. 664,000 are going to Nepal. I believe these are all going through the COVID program. I can really only find the U.S. announcing these, by the way, on the State Department Twitter account. I can't find any official announcement from USAID, the National Security Council, or the State Department, the organizations ahead of determining who gets these vaccines exactly, how they're making these, the decisions on who gets them. But it does seem largely that countries that the U.S. wants geopolitically to ally with it are recipients of a lot of vaccines. Also, countries who are able to successfully lobby in Washington, D.C. are getting vaccines. Overall, Nepal has gotten 2.2 million doses. Pakistan got 5 million shipment of doses and then a second one. And so that has brought the total number of the U.S. vaccines to Pakistan to 42 million. All these again through COVAX. Egypt is getting 1.5 million doses, and the U.S. says that over the past 4 months it has delivered 16 million doses to Egypt. And then Angola and Ghana are getting 2.5 million, with 800,000 going to Angola and 1.7 million going to Ghana.